Professor V. Habibullah, HOD University Chennai. Sir is deeply engaged in research activities within the Indian system of medicine, focusing particularly on clinical research. He served as a member of Institutional Ethics Committee at RIM Chennai and has extensive teaching experience in subjects such as pharmacology, pharmacognosy, clinical trials, and regimental therapies. His academic contributions include presenting papers at national and international conferences and publishing articles in peer-reviewed journals. Additionally, he was in charge of Unani COVID Care Center in Anipati, Tamil Nadu, which was the first of its kind for Unani medicine in the state. Doctor has also contributed as a member of Unani Pharmacopoeia Committee for the Government of India and has been honored with the Best Doctor Award by the Government of Tamil Nadu for his significant contributions to healthcare.
For collaboration of Unani system of medicine with modern system of modern healthcare. Before that, I'll just make you awake. See, I got a case of paralyzed ES. The patient came to me with huge amount of cases stating that they are going for surgery. And the case was diagnosed as paralytic ES. What is supposed to be done? The paralyzed part, the release part has to be kept apart in the model surgery. See, we don't have enough time. That's the major issue nowadays. See, this case actually was a case of fracture of femur. Okay. He went to a doctor. They said, yes, we have to put a POP, and there was mild injury, and there was also an injury. They gave him huge antibiotics, and that antibiotics led to diarrhea. For diarrhea, and they went to other physician. He gave them the drug for to stop the loose motions. And immediately after some time, because the patient didn't have motion, they went to another doctor. They took an USG and diagnosed it as a case of paralytic ES, and he was supposed to be wait another surgery for paralytic ES. See, what do you understand from this chronology? So we don't have enough time even to take the history of the patient. We just depend on lab reports. Okay, I'm not blaming that. Actually, it's just a complication of loperamide tablet. For that, he was wrongly diagnosed as paralytic ES and landed up in this condition. Actually, there was no need for any medicine at all. Within a day, he became normal. So what I mean to say is, again, back to my topic. What is the need for collaboration? See, the need for collaboration is, we assume that we don't need any collaboration with any systems of the medicine, but as such it's not so. See, each and every system has its own treasures. There are many diagnostic aspects, there are treatment aspects, and there are many philosophical aspects. As such, in Indian medicine, in the system of medicine, we have a holistic approach. It does wonders. In Siddhartha, there is a thing called as Unani. It does wonders. So we have a huge amount of treasures, but we are not able to transform it for the general public to take use of this. Similarly for hepatic disorders. See, in earlier days when I was student, there used to be huge tubes in Criticate because that was the only place which is considered as treatment for jaundice. See, after that, of course, we had a big college, and a number of patients come to Indian system of medicine for the complications of liver disorders. Jaundice still, according to the Unani text or the Siddha text or Ayurveda text, it is considered as disease, whereas the modern science is considered as a symptom. But according to the text, if you give the medicine, it will cure anything. Let it be a small malignancy, let it be a obstruction in bile tract, whatever it is. But if you think according to the text, we have got very good results. Similarly, renal calculi. Renal calculi, I think only the Indian system of medicine people treat with medicine. Even these type of things we can have a collaborate with the modern people and we can. Then cholelithiasis. Can you treat cholelithiasis? Any Siddha? Can you treat cholelithiasis? Yes, we can treat cholelithiasis. We have got number of drugs for that. A simple thing like even olive oil early morning that or apple cider vinegar that also gives cholelithiasis. Similarly, we have used many number of combinations for hemorrhoids, fistula, etc. And for non-healing ulcers, we have number of therapies like leaf therapy and other things. And we have also medications. See, these are medications. Apart from that, what ISF can do is, we collaborate with the modern thing. We can treat with cost-effective treatments. See, it's not that we use only costly medicine in ISM. Even simple home treatments with other items like Zira, pepper, etc. Even these things have a huge amount of huge potency to treat number of diseases. We can use those type of things. In Unani, we have a thing called as Dava Veda, which acts wonders in treatment of constipation. And simple things. There is a drug called as Phosphate, which we use in epidemics. And in prevention, what did we do for COVID? Did we directly go for vaccination? We just adopted procedures. These procedures, in Unani, we call it as regimen therapy or Ayurvedic therapy. See, one of the procedures, though not mentioned in Unani literature, is mask. But simple procedures, even washing of hands is also a procedure, which was very essential during COVID. So, COVID taught us a number of things. How many hypertension clinics, how many diabetes clinics were closed during COVID? There was not a single thing, but still we managed and we are helping the world. See, the thing is, what I mean to say here is, yes, with certain procedures, even exercise or massage, they play a major role. So you can prevent a number of diseases using by these type of techniques. Okay, normally, in Indian system of medicine, people think it is behind religion. Some assume that Ayurveda belongs to Hinduism, homeopathy belongs to Christianity, Unani belongs to Muslims. It's not so. Religion is not a barrier. Culture is not a barrier for medicine. Indian system of medicine. And in some cultures, we assume that so-and-so medicine, so-and-so thing can be taken as medicine. For example, tying neem leaves during some epidemics. See, those cultural habits also have some medical value. And there is quite a bit of cultural relevance in medicine. Application of turmeric for in case And of course, it gives some glow and it acts as an antibiotic, etc. Before collaborating, first thing is we must join hands in audit system, and then we can face the other challenges. Now, what are the common challenges we face? First thing is we assume ourselves that we are degraded by modern fraternity, or why did you take Indian medicine? Why did you get accepted in Indian medicine? Why did you get Indian medicine? Or is there real reply for it? So we ourselves consider that we are inferior. So it's not a fact. There are some parents who wanted their children to study Indian medicine. So don't assume that you are inferior to any person. Of course, we lack some scientific knowledge. See, these scientific knowledges and certain RCTs, they are not tailor-made for Indian system of medicine. So we have to plan out some protocols which should fit our system of medicine. And whenever there is an opportunity, just grab it. When did we grab the opportunities to show that ISM is good? During epidemics, COVID, dengue, chikungunya, etc. Because whenever people consider that there is no treatment in modern medicine, they turn towards us. Grab that opportunity and use it. Of course, there will be some regulatory things in collaboration. For example, if you are doing some minor surgical procedures, it will not be allowed in Tamil Nadu, but whereas it will be allowed in other places. So these regulatory hurdles will be present here and there. Just ignore them. And as I told you earlier, there is not one treatment, one disease theory in any Indian system of medicine. Okay, then what we face in as a problem in IS is whenever any drug gets its name, we have lot of counterfeiters. For example, Ruabza. There are not less than 80 companies who manufacture some syrups similar to Ruabza. It will be same in taste, it will be same in color, bottle will be same, just some alphabetic changes to be there. So we have to take care of those things. And another thing, we can't solely depend on this thing, pharmacies. See, for example, there is a drug called as Tataplay in Unani. The drug, 60 grams drug costs 125 rupees. As per the formulation, in 60 grams of drug, you are supposed to have at least 3 grams of saffron. So practically, the manufacturer has not put saffron according to the formulation. So these type of the problems we are facing, especially these things cannot be appreciated. So quality control is an important thing. We have to take care of those things. Then there are a number of misconceptions that Unani medicine doesn't work. Again, the same thing. The protocol, what we follow in modern things, that doesn't suit exactly for Indian system of medicine, especially Unani. And then we have another thing in research. So we always compare our drugs with modern drugs. Why can't you compare the drug which is empirically being used? Why you want to treat arthritis patients and compare with the diclofenac or some other analysis? Why can't you compare Abesaritan or Aswagandha in this thing, Ayurveda? So it's always better to set our own drug as a control factor and treat or compare with the drugs you are going to study. As far as knowledge gaps are concerned, see, initially we also assume that we cannot do everything in the world. We just approach our director and asked us, please give us some modern hospital where we can prove ourselves. Our director immediately got permission from the hospital called as the super specialty hospital. When we started there, nobody really knew what Unani is. Initially, 20 to 25 patients came on reference. Now, we are having nearly 75 to 80 patients per day. They come only for Unani, not for other things. So, what we want to say is, you must do whatever you think which is right, and you must dedicate yourself, and God will give you opportunity to do. Okay, there will be a lot of things before we collaborate with other things. There will be a lot of homework. For example, taking 250 grams of beans or beans juice that will give renal failure, which is neither scientifically proven nor any patient had. They might have diarrhea, but apart from that, I don't think they have something. Then another thing what we normally think is, we assume that this treatment aspect, I should keep it secret. There is no secrecy in medicine, just open. See, if you know some formulation or if you know some treatment aspect, just discuss it and you disseminate it to others. That can be the only way that can propagate our system of medicine. Okay, then we can also have some high-tech pharmacies and collaborate with them. Say one of the things, one of Unani doctor named Dr. Sarat, she is number 2 in the state of Tamil Nadu as far as hair and cosmetics. So what she has done is, she has made use of it. She has collaborated with modern doctors, she has collaborated with others, and she has done a number of new treatment aspects, collaborating with modern things. So collaboration will always help us, and it will prove us a successful thing. See what we have done. What we have done is, see, his name came into fame. Though he is a freedom fighter, he is a person who built up communal harmony, etc. But the first drug to be used in hypertension is reserpine. Reserpine is obtained from norepinephrine. See, because of this contribution, there are some molecules that are being named after Hakim Abdul Khan. See, what we did was, he started a college, not only Unani, also Ayurveda, collaborating with our ASM. Siddhamit, please don't ask me why he didn't start Siddhamit, because he was not aware of Siddha, other things that have started here Siddhamit. Similarly, he collaborated with modern people, and he was the first person to give a drug, Ralkia serpentina for hypertension. Hypertension is not in Unani system of medicine. We call it as Kamal Singh, Mitra, and other clinical cases. So he was a collaborator of ASM as well as modern people. And not only that, there is collaboration at the universal level. See, WHO, they have a strategy. There is a number of things. One of the things is they have given a benchmark for clinical practitioners for Unani medicine, and they have come up with ICD-11. ICD-11 is nomenclature or terminology by which we can explain the names of diseases, treatment, medical features, etc. These terminologies is accepted throughout the world. We treated this case. Since this is a case of severe and massive ulceration, and in the span of 60 days, we almost treated this. Similarly, Dr. Arvind has also treated a case. See, when you have these type of treatment, why should you think about other things? The whole world will come to you if you show these type of things, because the see, the modern world needs something for their treatment. When you have the resources, you have to tell it openly. This is just collaborating with modern doctors.